We are Pacific Post-partum Support Society, a nonprofit organization based in Burnaby, BC. We are trying to implement a new program consisting of educational workshops, cooking classes, and exercise classes to assist immigrant mothers who are experiencing PPD. We also have partnership with VCH.
Postpartum depression is a non-psychotic mood disorder characterized by feelings of extreme sadness, anxiety, and exhaustion. Our target population is immigrant mothers, as the Canadian Maternity Experiences Survey found that immigrant women are more likely to report higher levels of postpartum depression symptoms, less likely to have access to social support, and to have lower self-rated health in comparison to Canadian-born women. According to the World Health Organization, the incidence of postpartum depression within the first year of new motherhood is estimated to be 12 to 15% overall and 35% or more among high-risk mothers.
Our goal of this project is that we aim to increase access to PPD prevention and the treatment services amongst immigrant mothers.
By the end of the project, the number of immigrant mothers who may develop PPD will be reduced by 1/3, and those seeking for help will double. But we will also focus on giving immigrant mothers more access to information in other languages and reduce the stigma of PPD.
We want to start a prevention and resource program that will mainly cater to immigrant families. As Pacific Postpartum Support Society, we want to create a program that involves having classes conducted at local community centers for easiest access. The most important aspect of this program is we can bring together those who need more support and provide a group they can rely on. During these classes, we want to raise awareness about postpartum depression, which includes trying to improve psychological well-being to protect against PPD. We will have 3 different classes with different purposes for each: educational, physical, and nutritional. The educational classes will talk about topics such as maternal and infant care or signs and symptoms of PPD. The exercise classes will show mothers different exercise routines that can be easily done at the comfort of their own homes. Lastly, cooking classes will go over nutritious meals for mothers during and after pregnancy. We ultimately want these classes to target mothers, their family members, and spouses. The main component of these classes is that they are free for these immigrant families.
After a year, we have 3 funding options: partnerships and sponsorships, advertisements, and donations. If we succeed in the project, we ask for increased funding from existing partners. Build more partnership, especially an organization want to advertise services among workshop participants and mothers. Donations are available during the workshop as well as separately through donation campaign.
The first part of the evaluation plan is the evaluation criteria that involves questions about materials like brochures and accessing how well the workshops are running and the number of participants in these workshops. Next is methods of collecting and analyzing information using surveys will help mothers self-report how helpful the workshops are and to allow us to assess and document the effectiveness of the workshops. Observations during the workshops will also be used. Measurable performance indicators such as attendance logs, completion of the Edinburgh Postnatal Depression Scale, feedback from managers, and in-person observations to assess the quality of life of the participants and to look at the distribution of the increase or decrease of participants in the workshops. The project should be implemented because of the high rates of PPD among immigrant and first-time mothers. The expected results from the workshop activities will help mothers feel better mentally, emotionally, and physically. The objectives will be achieved when there is a decrease in the rates of PPD and immigrant mothers have access to resources in their own language.
In terms of budget, we would like to ask a total $67,092 funding. The proposed budget consists 30% travel costs, 29% venue, 90% salaries, 40% cooking, and 8% supplies.
It always seems impossible until it's done. We hope that you will support us fully and turn this dream into a reality.